Welcome to One UN, One Voice, a space where we unpack the most pressing issues facing Timor-Leste and explore collective solutions with those driving change on the ground. Today, our focus is on healthcare and well-being, a matter that affects every Timorese family, every community, and the future of the nation. From maternal and child health to communicable diseases, Timor-Leste's health sector faces layered challenges. Yet, with national leadership, global support, and community engagement, the path forward is filled with opportunities. With us today are distinguished guests who bring policy, expertise, and program action to the table. With us today are distinguished guests who bring policy, expertise, and program action to the table. We have Dr. Arvind Mathur, WHO representative.
Sure.
Welcome to the program, Arvind Bhai.
Thank you.
We have Dr. Dominguez Bernardo. She is UNFPA's assistant country representative. Welcome to the program, Mana Dominguez. Thank you so much for joining us today. I welcome you program which is around challenges, barriers, and strategic response within the health sector. And I must add that one of the most amazing thing in Timor-Leste, which links to the advocacy and government's ownership and leadership, and the political will you mentioned.
Absolutely, yes.
And that links to the UN's historical role,
Yeah.
and the trust and confidence Timorese leadership and Timorese people have on UN. And I think that allowed us to contribute to that extent. It's really amazing. Both of you mentioned something very interesting about access, and access linked to public behaviors. So my question is to both of you. Maybe we can quickly have your reflections on that, and then we can move to to particularities, other questions to you and to UNFPA. That in terms of public access, in terms of access and behaviors, what are the main reasons, like you mentioned, and Arun, you also mentioned, that people avoid or delay seeking care, even when services exist? What do you think? I mean, quick reflection, Mana Dominguez from your side and Arun Bhai from your side. What are the reasons? I mean, that you mentioned that the services are there sometimes, not sometimes, both. With us today are distinguished guests who bring policy, expertise, and program action to the table. We have Dr. Arvind Mathur, WHO representative in Timor-Leste. Then with him, we have Dr. Dominguez Bernardo, UNFPA assistant country representative. Thank you and welcome to the show, to the One UN, One Voice program. Ana Dominguez, Dr. Arvind Bhai. So our segment of the program is around innovations, community solutions, and the way forward. Like, in terms of building a stronger health system in the country. Dr. Dominguez, I would come to you that, from the point of view of access to reproductive health services, what innovations, or community-driven models are we using? How UN agencies, how UNFP under the banner of, One UN is supporting the communities, the government, the people, to utilize these models and resources so that we could have better access to reproductive health services.
Okay.
For instance, youth engagement.
Yes,
you already alluded to.
I can start with, of course, for all sexual and reproductive health services,
Right.
particularly for sure for family planning services. So. In order to, one of the key components of a program of SRH is family planning. You cannot reduce maternal mortality if you don't have a family planning program. So from the government, from Ministry of Health, I think 2 years ago, the launch of program is very innovative. I think in terms of tackling the issue, especially sensitive issue, using the terms of birth spacing 3 years
Right.
in order to
to gap actually to
between
gap
children,
the
and in that point it will reduce also the morbidity, maternal morbidity, and also mortality. So that's the main point. So how you engage, of course, the process involving different actors, including the Catholic Church, faith-based organizations, civil society, government, UN
youth,
system, and
communities.
yeah, youth community. But in terms of youth, I would like to say young people has right to access to the right and age-appropriate information and services. So I would like to say, mention a model that government in this Ministry of Youth, Sport, Arts and Culture that implement a program called youth relationship, a healthy relationship, which is this out of school comprehensive sexual education. Why this is a good model? Because this is run by youth centers in all 13 municipalities. So young people, they are the one lead the facilitation. But they are facilitator. They train the youth out there from so it's out of school. So it's run by youth center in municipalities. The program is
and those youth centers are managed by
it's under Ministry of Youth.
Ministry of Youth,
yeah.
okay.
Yes,
And UNFPA is working in close collaboration with Ministry of Youth and Sports and
Yes.
Culture. Okay.
Yes, but I'd like to say also why this program was established. This is built on from a research. Also, that time, it's Secretary of State of Youth and Sport. They did a research for teenage pregnancy and early marriage, and from that findings, there is 1 in 5 young women between 18 to 24. They get married before age of 18. Age of 18.
Okay.
Yeah, 18 and age of 18, and then they get the first child before 20 years old. So this is a very big challenges. If you talk about reduction of maternal mortality, if this is not, we cannot tackle this, and then this will not, the problem will not maybe partially solved. So that's one. But I would like to say the program is why it's very important is community engagement.
Is it being well received by the people, by the communities?
Because when you do the process of developing the training manual, it take 2 years. 2 years involving different actors, including the Catholic Church. So this is very high commitment from all actors, including the government. So I think this is one of the good example, and this best practice has been shared with the other country also in the region. So I think for me so they do it in by facilitated by youth and also up to school level. So that's why I said this
that is one of the most important things. I mean, you know, as mentioned by Arvind Bhai earlier, by you also reaching down to the communities, to the village level, to the rural areas where people do not have lot of access, where people do not have access to services also, you know, and addressing those issues. Thank you, Mana Dominguez. This can be good. Thank you, Mana Dominguez, once again. The next area I want to touch upon is the future outlook and the partnerships. Which both of you at the very outset in our first segment you mentioned how partnerships are important, but you know this area where I want to touch upon is now the future outlook. Arvind Bhai, I will start with you. You know, you and Mana Dominguez also, you are sister agencies, WHO, UNFPA and other agencies, they work very closely with the government. What are the top national priorities for the next 5 years? And the second bit of the question is, you know, related to partnerships, that how we are helping, how we are building partnerships, and how we are collaborating with the government, how other UN agencies, civil society, you know, and other partners are coming together to help the government to achieve those priorities in next 5 years. So the question is for both of you. Arvind Bhai, to start with you, and then to Mana Dominguez.
Ahmed Bhai, thank you. This is a very kind of a multiple questions.
Multiple question after question, but you know, we can,
one or two questions.
but
yeah.
we can, I mean, we can unfold it
Yes,
into,
I mean,
you
let's
know,
try and
yeah,
unfold it. And I think, you know, like to me, we have already alluded on the priorities that the health sector faces, from health system resilience to areas of addressing the triple burden, but not losing the sight of the gains in the maternal, newborn, child and adolescent health areas, but all within the whole reams of a resilient health system, which is also climate resilient and environmentally sustainable. And within that whole, you know, like if one looks into this whole spectrum of priorities, certainly the partnerships play a very critical role. But you know, we are also that the geopolitically, the globally, the way that things are changing in today's time, the Timor-Leste health sector cannot remain untouched because of that. And for that very reason, the first and the foremost, you know, effort from all of us together has been to continue to advocate with the government for increasing domestic investment in the health sector.
Excellent. I mean, this is the what we want to number. I mean, you know, number one this, number two this, number three this, number four this. Very true.
And
very
this
good.
is why, you know, like increasing
investment.
Absolutely, and increasing investment domestic, but also looking into our very important partners, the development partners and donors, you know, like to look into the comparative strength of the UN system, the technical agencies and implementing partners, and then to be able to also bring in the value added resources, be it the global financing mechanisms like Gavi, Global Fund, Green Climate Fund, but also bilateral partners, both which are resident in Timor-Leste and those who are, you know, like non-resident but support Timor-Leste. We know fully well that the, you know, like the financing environment and the financing situation is changing even for these donors back in their homes. But we would appeal that Timor-Leste is at that stage as a young country where the gains have been made. And if we do not continue to support, the chances of slippages are very high, they will not be able to achieve SDG targets. And this is where, you know, like I would say that we as the UN, both, you know, like programs, funds, specialized agencies, all of us together have a responsibility to be walking the journey with the ministries, with the government, with the people of Timor-Leste. My, you know, like that is my second point with regard to advocacy with the development partners. But thirdly, you know, like what we need to also do together is to bring the, you know, like evidence-based practicable solutions to the government. For example, digitization and digitalization. The reason I am saying that digitalization is a great enabler in health. And if we can provide these solutions to them, it offers them a unique chance, because it would result into cost efficiency. It would result into, you know, like, for example, telemedicine that we are now trying can reach to the remote areas with the specialist care.
By the way, are we trying telemedicine in Timor-Leste?
Yes, very much.
Maybe later on if you can, if you
yes,
have time.
certainly. And we are also looking into helping the government put the, as a fourth action, once we have had a policy in place like Programa Integrado Saudi, as well as the vitalization or revitalization of community health volunteers, I think it is critical that we help them implement this to the success for the programs actually. So again, you know, like depending on our support, comparative advantages, we as the UN system can continue to be walking this journey step by step with the government. And you know, like also I would say lastly is this whole effort that we need to make to in one way or the other, you know, like on the point that I said earlier with regard to the political will, that how do we continue to bring whether it is, you know, like we say evidence-based advocacy, or we talk about a collective voice, we talk about bringing the global frameworks to the country, or we talk about the voices from the communities, the people. I mean, all of this needs to take it to the political level so that they can sustain the investment. It may be parliamentarians, it would be the leaders. We need to continue to advocate for the actions for the people so that people continue to have trust in the system. We continue to invest in improving quality. We continue to work and improve competencies. We make sure that we provide technical assistance to the ministry for ensuring no stockouts for drugs, diagnostics and devices. We have the right technical tools to be able to provide. I mean, all of this will actually result into a better resilient health system which is more prepared for the future, fit for the purpose as we get into the next 5 years. I think to me that's the five or six thing what I could say and share with you.
I'm impressed. I'm always impressed by by your wisdom and knowledge, but I'm more impressed now.
Thank you so very much.
I'm spellbound.
I'm humbled.
You mentioned about the investments. You mentioned about the comparative, looking into and taking advantage of the comparative, comparative advantages we have as partners, I would say, right?
Yes.
Partners of the government and support of the government. Adding, value to the services, digitalization, and leading everything to a bigger, greater, stronger political will. I think, this is an excellent ingredients for the next 5 years, how to retain, how to sustain the gains we have achieved so far and the milestones we have covered. Mana Dominguez, to you, what is your recommendation? What is your vision in terms of how to achieve these what are the priorities first of all, and how to achieve those priorities and how to sustain those elements which we have gained?
Okay, I think as the ninth constitutional government is emphasized on, is committing to achieve universal health coverage through a very comprehensive primary health care approach, which I want to emphasize again, reproductive, maternal, newborn, child, adolescent health strategy is one of the centerpiece beside this non-CDC and CDCs. This is one of the priority that all partners need to support the government to implement the strategy, the one that is aligned with the SDG, aligned with national priorities up to 2030. So that's one of priority, and I want to say that for partnership, at the moment is even more needed. We need to coordinate the partners, development partners, the sister agencies, in order to support the government to implement the national priorities, in order to achieve this universal health coverage. Otherwise, this will continue to talk, these papers. But we can see that now increasing of the domestic investment. I want to mention about now government is procuring the maternal health drugs, family planning commodities, the medical equipment, through, of course, the different agencies, including UNFPA. So this is a good sign and a very high commitment from the government of Timor-Leste. That's why from partners, we as a technical agency, we need to, again, I will echo Dr. Arvin, we need to provide the evidence, policy, advocacy in order to continue invest in the key priority area of government of Timor-Leste in health sector.
In health, thank you so much. Just one last sentence. In one sentence, what is your message to the people of Timor-Leste about building a healthier and hopeful future? Arvind Bhai, to you, and then we will end with Mana Dominguez.
The last word should be Mana Dominguez, right?
Yeah.
Of course. It's very difficult to sum it up in one sentence, but to me, health is the greatest wealth, and health is the foundation of both, hope and the future opportunities. So I would just say that by investing and protecting the health of every Timorese, we are actually building the future of Timor-Leste stronger, fairer and full of promise. Through prevention, partnership and actually people that is my like my whole bet is on people. The future will be written in the health of its people, particularly with, I would say, the future of the people would be written in confidence with a lot of opportunity, hope and promise.
Thank you. What an amazing sentence. To you, Mana Dominguez.
Of course, healthy Timor-Leste will begin with healthy women, children and youth. We cannot avoid that. For UNFPA, of course, together with the other sister agencies, commit to ensure, I will start with one, to ensure all delivery are safe. And
All deliveries are
assisted
safe.
by skilled birth attendant. That's a priority in order to prevent preventable maternal death. The second, all young people has right to access sexual and reproductive, age-appropriate sexual and reproductive health information and services. The third, when we individual or couples, they want to do a spacing 3 years as a government campaign, and the service of family planning need to available from Dili up to remote area. So that's the message.
Thank you, Mana Dominguez. So this brings us to the close of the program. Thank you so much, Arvind Bhai. Thank you so much, Mana Dominguez, for joining us today. Today's dialogue reminds us that health is not just a sector. It is the foundation of human dignity, national development, and better future. From policy to practice, the commitment to improve healthcare in Timor-Leste is real. But it will take all of us working together to turn the vision into a reality. To our guests, thank you for your leadership and insights. And to our viewers, thank you for tuning in. Until next time, stay informed, stay healthy, and continue raising your voice for better Timor-Leste. And goodbye and thank you so much.
Thank you.
Thank you very much.
Obrigado, Barack.